Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Riedels Thyroiditis. Riedels Thyroiditis is a rare variant of thyroiditis, and this Riedels Thyroiditis is also known as Riedels stroma, or it is also called as invasive fibrous thyroiditis. It is called as Riedels stroma or invasive fibrous thyroiditis. So, in Riedels thyroiditis, here there is replacement of all the thyroid parenchyma. All the thyroid parenchyma is replaced by the fibrous tissue. This Riedels thyroiditis also invades the adjacent tissues. It mainly occurs. Why does this Riedels thyroiditis occurs? This Riedels thyroiditis occurs as a primary autoimmune etiology. Right. This Riedels thyroiditis is also associated with certain disorders. So, Riedels thyroiditis is associated with three main important disorders like the Riedels thyroiditis is associated with mediastinal or retroperitoneal fibrosis. It is associated with retroorbital fibrosis and periorbital fibrosis. Then Riedels thyroiditis is also associated with sclerosing cholangitis. Now, clinical features of Riedels thyroiditis. Riedels thyroiditis more commonly occurs in women, that too of the age group of 30 to 60 years of age. So, a patient with Riedels thyroiditis will present with a painless anterior neck mass, especially in the region of thyroid, which develops and which progresses over the weeks to years. And this will cause some compressive symptoms. It compresses the esophagus. When it compresses the esophagus, it causes dysphagia. Then, if it compresses the trachea, it causes dyspnea and choking, and it can also cause hoarseness of voice. Along with that, the patient can also have the because the gland is replaced by the fibrous tissue, there is symptoms of hypothyroidism is seen. Along with that, there is symptoms of hypoparathyroidism is also seen in the patients. Then slowly on examination, if you examine the thyroid region, you will see that there is hard woody thyroid gland is seen with fixation. Then this is the clinical features. Then how you going to diagnose the conditions? Diagnosis is mainly done by an open thyroid biopsy. You will do an open thyroid biopsy, and on the biopsy you will see that there is firm fibrous nature of the gland is seen on biopsy. And here, because it is firm and fibrous, FNAC is not adequate for uh, the diagnosis of Riedels thyroiditis. Then treatment of Riedels thyroiditis. First, in the treatment of Riedels thyroiditis, we should do surgery. Actually, surgery is the mainstay of treatment for the Riedels thyroiditis. And if it decompresses the trachea, then we should excise the thyroid isthmus should also be done. If it decompress, first you should decompress the trachea and excise the tissue by a wedge compression. Some patients can have good improvement with tamoxifen and corticosteroids. With the help of tamoxifen and corticosteroids, improvement is seen in some patients with Riedels thyroiditis.
thank you and thank you for watching.